This is Kylie Jenner's breast implant. I think it's important to talk about. So let's talk about the risk of getting a breast augmentation. First risk, anytime you have surgery, there's always a small chance of bleeding and infection. When we cut your skin, it bleeds. We do everything we can to stop that bleeding. There's always a small chance that it keeps bleeding or it bleeds after the case. We always do everything we can to prevent infection, especially with breast implants. We are extra careful to prevent any sort of infection. We do everything very sterilely. We do not touch these implants at all in the operating room because even subclinical infections around breast implants has been linked to capsular contracture, which is the next risk that you should know about. Capsular contracture is when your body forms scar around the breast implant, and the scar is really tight and hard, and it can be painful, and it contracts around the implant. It can kind of distort the shape of the implant and make it rise up and high, and like I said, it can hurt. So if that develops, the treatment is to go take out that capsule, that scar tissue. Next things to know about. There's a chance you might not like it. I always list undesirable cosmetic result on the list of things. You might think you really want a breast augmentation and then decide you don't. After you get a breast augmentation too, you also will notice any asymmetries that may have been there before a little bit more pronounced. So if I notice any asymmetries in pre-op, I always point them out to the patient. That way they know that just because we stick a breast implant behind their breast, it doesn't change the fact that sometimes one is slightly wider than the other, and none of us are perfectly symmetric. And we can try to do little things to fix that in the operating room. But anyways, I always say sisters, not twins. They're always going to be close, really as close as we possibly can. No two breasts are exactly identically perfect. Changes in nipple sensation. Sometimes people experience slightly more sensation, slightly less. Most of the time when there's swelling, people experience slightly less, then it comes back to normal, and after a very short period of time. The exception to this would be if you have a periareolar incision, which is an incision around the nipple. Sometimes that can change sensation a little bit more than if you have the incision underneath the breast. Same with breastfeeding. For the most part, people do not have issues breastfeeding, but if you have an incision around the nipple itself instead of underneath the breast, that can increase difficulty with breastfeeding just because there's scar around the nipple. I would not let this deter you from getting a breast augmentation if you want to breastfeed. Tons of women do it every single day and are totally fine. Last but not least, the scary one is breast implant associated lymphoma. So this is a very rare cancer. I think the most current statistics are about 1 in 3,000, but it's specifically associated with a type of implant that has been taken off the market. They were a specific type of textured implant, and something about that texturing process caused an kind of over response from your immune system, which led to lymphoma development. This lymphoma was localized in the capsule around the breast implant. So the treatment is just to remove the capsule, remove the breast implant. Most people did not need any chemotherapy or anything like that, and it's self-limited. So those are the main risks of getting a breast augmentation. If you have any questions, let me know in the comments.